Hi, myself Dr. Sreeya Nair, NSS Program Officer of Unit number 97 from Sree Ayyappa College for Women. Let us have a look at how we manage ourselves from COVID 19 stress. On March 11, 2020, the World Health Organization characterized COVID 19 as a pandemic. The overarching aim of the Global Strategic Preparedness and Response Plan for COVID 19 is to control COVID 19 by suppressing transmission of the virus and preventing associated illness and death. Current evidence suggests that SARS CoV 2, the virus that causes COVID 19, is predominantly spread from person to person. Understanding how, when, and in what types of settings SARS CoV 2 spreads is critical to develop effective public health and infection prevention and control measures to break chains of transmission. We all know SARS CoV 2 is the virus that causes coronavirus disease 2019. It is a severe acute respiratory distress syndrome. And this slide briefly describes possible modes of transmission for SARS CoV 2, including contact, droplet, airborne, fomite, fecal oral, bloodborne, mother to child, and animal to human transmission. Infection with SARS CoV 2 primarily causes a respiratory illness ranging from mild disease to severe disease and death, and some people infected with the virus never develop symptoms. Contact and droplet transmission. Transmission of SARS CoV 2 can occur through direct, indirect, or close contact with infected people through infected secretions such as saliva and respiratory secretions or their respiratory droplets, which are expelled when an infected person coughs, sneezes, talks, or sings. Respiratory droplet transmission can occur when a person is in close contact, that is about within 1 meter, with an infected person who has respiratory symptoms or who is talking or singing. In these circumstances, respiratory droplets that include virus can reach the mouth, nose, or eyes of a susceptible person and can result in infection. Indirect contact transmission involving contact of a susceptible host with a contaminated object or surface. Surface means fomite transmission may also be possible. Then when we come to airborne transmission, and is defined as the spread of an infectious agent caused by the dissemination of droplet nuclei, that is aerosol, that remain infectious when suspended in air over long distances and time. Airborne transmission of SARS CoV 2 can occur during medical procedures that generate aerosols. WHO, together with the scientific community, has been actively discussing and evaluating whether SARS CoV 2 may also spread through aerosols in the absence of aerosol generating procedures, particularly in indoor settings with poor ventilation. The physics of exhaled air and flow physics have generated hypotheses about possible mechanisms of SARS CoV 2 transmission through aerosols. These theories suggest that a number of respiratory droplets generate microscopic aerosols by evaporating, and normal breathing and talking results in exhaled aerosols. Thus, A susceptible person could inhale aerosols and could become infected if the aerosols contain the virus in sufficient quantity to cause infection within the recipient. However, the proportion of exhaled droplet nuclei or of respiratory droplets that evaporate to generate aerosols and the infectious dose of viable SARS-CoV-2 required to cause infection in another person are not known, but it has been studied for other respiratory viruses. Some studies conducted in healthcare settings where symptomatic COVID-19 patients were cared for but where aerosol generating procedures were not performed reported the presence of SARS-CoV-2 RNA in air samples, while other similar investigations in both healthcare and non-healthcare settings found no presence of SARS-CoV-2 RNA, and no studies have found viable virus in air samples. Within samples where SARS-CoV-2 RNA was found, the quantity of RNA detected was in extremely low numbers in large volumes of air, and one study that found SARS-CoV-2 RNA in air samples reported inability to identify viable virus. So, the detection of the RNA using reverse transcription polymerase chain reaction, that is RT-PCR based assays, is not necessarily indicative of replication and infection competent, that is viable virus that could be transmissible and capable of causing infection. Recent clinical reports of health workers exposed to COVID-19 index cases not in the presence of aerosol generating procedures found no nosocomial transmission when contact and droplet precautions were appropriately used, including the wearing of medical mask as a component of the personal protective equipment PPE. These observations suggest that aerosol transmission did not occur in this context. Further studies are needed to determine whether it is possible to detect viable SARS-CoV-2 in air samples from settings where no procedures that generate aerosols are performed, and what role aerosols might play in transmission. And also, from the outside of medical facilities, some outbreak reports related to indoor crowded spaces have suggested the possibility of aerosol transmission combined with droplet transmission, for example, during choir practice, in restaurants, or in fitness classes. In these events, short-range aerosol transmission, particularly in specific indoor locations such as crowded and inadequately ventilated spaces over a prolonged period of time with infected persons, cannot be ruled out. Then when we come to fomite transmission, respiratory secretions or droplets expelled by infected individuals can contaminate surfaces and objects, creating fomites. Viable SARS-CoV-2 virus or RNA detected by RT-PCR can be found on those surfaces for periods ranging from hours to days, depending on the ambient environment, that is including temperature and humidity, and the type of surface, in particular at high concentration in healthcare facilities where COVID-19 patients were being treated. Therefore, transmission may also occur indirectly through touching surfaces in the immediate environment or objects contaminated with virus from an infected person, followed by touching the mouth, nose, or eyes. Despite consistent evidence as to SARS-CoV-2 contamination of surfaces and the survival of the virus on certain surfaces, there are no specific reports which have directly demonstrated fomite transmission. People who come into contact with potentially infectious surfaces often also have close contact with the infectious person, making the distinction between respiratory droplet and fomite transmission difficult to discern. However, formate transmission is considered a likely mode of transmission of SARS-CoV-2 given consistent findings about environmental contamination in the vicinity of infected cases and the fact that other coronaviruses and respiratory viruses can transmit this way. And some of the other modes of transmission. SARS-CoV-2 RNA has also been detected in other biological samples, including the urine and feces of some patients. One study found viable SARS-CoV-2 in the urine of one patient, and 3 studies have cultured SARS-CoV-2 from stool specimens to date. However, there have been no published reports of transmission of SARS-CoV-2 through feces or urine. Some studies have reported the detection of SARS-CoV-2 RNA in either plasma or serum, and the virus can replicate in blood cells. However, the role of blood-borne transmission remains uncertain, and low viral titers in plasma and serum suggest that the risk of transmission through this route may be low. Currently, there is no evidence for intrauterine transmission of SARS-CoV-2 from infected pregnant women to their fetuses, although data remain limited. WHO has been recently published a scientific brief on breastfeeding and COVID-19. This brief explains that viral RNA fragments have been found by RT-PCR testing in a few breast milk samples of mothers infected with SARS-CoV-2, but studies investigating whether the virus could be isolated have found no viable virus. So, the transmission of SARS-CoV-2 from mother to child would necessitate replicative and infectious virus in breast milk being able to reach target sites in the infant and also to overcome infant defense systems. Implications for preventing transmission. Infected people without symptoms can transmit the virus, and it is also prudent to encourage the use of fabric face mask in public places where there is community transmission and where other prevention measures such as physical distancing are not possible. Within healthcare facilities, including long-term care facilities, based on the evidence and the advice by the COVID-19 IPCGDG, WHO continues to recommend droplet and contact precautions when caring for COVID-19 patients and airborne precautions when and where aerosol generating procedures are performed. WHO also recommends standard or transmission based precautions for other patients using an approach guided by risk assessment. Take everyday preventive actions. What are the actions we can take every day? Let us have a look. Wear a mask, maintain social distancing, wash your hands frequently, use alcohol-based hand sanitizer, avoid touching your eyes, nose and mouth, stay home when you are sick, cough or sneeze into a tissue or your elbow, clean and disinfect frequently touched objects and surfaces such as especially mobile phones. Refrain from smoking and other activities that weaken the lungs. How will you take care of your body? It is very important. Meditate, eat well balanced meals, take deep breaths and exercise. Aside from staying safe, ensure that you are taking steps to keep yourself healthy. Prefer foods that contain healthy sources of unsaturated fats such as fish and nuts. Stay hydrated. Always drink enough water. Avoid hazardous and harmful alcohol use. This is very important. We have to follow WHO's 5 keys to safer food. Keep it clean, separate raw and cooked food, cook it thoroughly, keep food at safe temperatures, use safe water and raw materials for food preparation. How will you take care of your household's emotional health? We all know the outbreaks are stressful for both adults and children. Children may respond differently to these stressful situations. So you have to talk with your children and answer all their questions. Let them voice out their fears or worries. Practice meditation as a whole unit. Then we are coming to the main portion of this presentation, COVID-19 vaccination. As the majority of the population is still susceptible to the SARS-CoV-2 virus and the virus spreads easily, it is clear that a safe and effective vaccine is needed to prevent further cases. A COVID-19 vaccine prepares the immune system so that in the event of exposure to the virus, it is able to respond and prevent or reduce the severity of infection. A vaccine will produce the same immune protection which usually follows natural infection but without causing disease. It generates long-lasting immunity so that the person is protected if they are exposed to the antigen several years after vaccination. It interrupts the spread of infection by preventing carriage of the organism in the vaccinated person. And vaccines need to be safe, and the risk from any side effects should be much lower than the benefit of preventing death and serious complication of the disease. For the COVID-19 vaccines, many of these properties can be confirmed from the clinical vaccine trials. Long-term ongoing surveillance of the disease and of those vaccinated will show whether vaccine protection is long-lasting or booster or annual doses are needed. The vaccine prevents a vaccinated person from carrying and spreading the virus. This is very, very important. What are the myths and facts about this COVID-19 vaccine? There are certain myths spreading widely in the public, in the society. One of the myths is the COVID-19 vaccine is unsafe because it was developed so quickly. The actual fact is that the authorized vaccines are proven safe and effective. Although they were developed in record time, they have gone through the same rigorous Food and Drug Administration process as other vaccines, meeting all safety standards. Another myth is the COVID-19 vaccine will alter my DNA. The fact is that the first vaccines granted emergency use authorization contain messenger RNA, that is mRNA, which instructs cell to make the spike protein found on the new coronavirus. When the immune system recognizes this protein, it builds an immune response by creating antibodies, teaching the body how to protect against future infection. The mRNA never enters the nucleus of the cell, which is where our DNA, that is the genetic material, is kept safely. The body gets rid of the mRNA soon after it is finished using the instructions. Then another myth, the COVID-19 vaccine has severe side effects such as allergic reactions. The fact, some participants in the vaccine clinical trials did report side effects similar to those experienced with other vaccines, including muscle pain, chills, and headache. And although extremely rare, people can have severe allergic reactions to ingredients used in a vaccine. That's why experts recommend people with a history of severe allergic reactions, such as anaphylaxis to the ingredients of the vaccine, should not get the vaccination. Another myth is the COVID-19 vaccine causes infertility in women. Actual fact, misinformation on social media suggests the vaccine trains the body to attack syncytin-1, a protein in the placenta, which could lead to infertility in women. The truth is that there is an amino acid sequence shared between the spike protein and the placental protein. However, experts say it is too short to trigger an immune response and therefore does not affect fertility in women. Another myth is once I receive the COVID-19 vaccine, I no longer need to wear a mask. It is not a fact. The actual fact is masking, hand washing, and physical distancing remain necessary in public until a sufficient number of people are immune. Fully vaccinated people can meet with other fully vaccinated people without wearing mask. Then next one, you can get COVID-19 from the vaccine. Is it so? No, never. You cannot get COVID-19 from the vaccine because it does not contain the live virus. Even I have doubt in the initial period where I got confused whether it contained live virus, live attenuated virus or not. So that we need not worry about that. COVID-19 is free of live virus. COVID-19 vaccine is free of live virus. Then another myth, I am not at risk for severe complication of COVID-19, so I don't need the vaccine. Fact, regardless of your risk, you can still contract the infection and spread it to others. So it's important you get vaccinated. Once the vaccine is widely available, it is recommended that as many eligible adults as possible get the vaccine. It's not only to protect you but your family and community as well. So the situation may be overwhelming, but coping with stress will make you that the people you care about and your community is stronger. Don't be selfish. Please concentrate on yourself and our community too. Let us have a peaceful, stress-free life and enjoy the remaining life without fear of COVID-19. Thanks for watching this presentation. Thank you. Thank you so much.